Hi, my name is Dr. Jesse Scholes. I'm a physical therapist. I work out of Mugwanago, Wisconsin. I'm going to be talking to you today about lower extremity or leg and hip, PNF, proprioceptive neuromuscular facilitation. Basically, it's a fancy way of saying body control. Now, these exercises are going to be great for people that have hip, ankle, or knee pain or stiffness, potentially arthritis, as well as great for people that are looking to prevent injuries to the ankle, hip, and knee. Now, as we get older, most of us tend to kind of stop twisting. We don't put our foot on the ground and intentionally grind on it by basically twisting our body. And for the most part, I think that's good. However, what a lot of us don't realize is every time we take a step, every time we run, and even just turning a corner in your house, you are twisting. So if we only do things for exercise and training, we're working straight forward and back, we're working side to side, and we never do a little bit of controlled rotation, I think our body suffers from that. Now, this exercise is going to use muscles from the trunk, the kind of ribs, all the way down to the feet, depending upon how you want to do it. But the big thing is, I've never had anybody that had an injury from this at all. It seems like something that should be stressful, but if you listen to your body and only take as large of a step as you feel comfortable doing, number one, and number two, carefully progress the resistance, slowly progress the resistance, you should be fine. All you need to do this is an ankle strap and a cable pulley system, which most fitness clubs tend to have, or you can get a sport cord for yourself with the ankle strap, and you can do this at home. So I'm going to basically put up a link next to the video of me doing these exercises because a lot of people get confused about it. What I've done is I've lowered the cable pulley to the lowest setting on the arm of the machine. I've connected the cable with the ankle strap to my right foot, and now we're going to focus on the left. I'm going to stand so that the machine is straight behind me. I will place my left foot pointed 45 degrees to the right. I'm going to bring my right leg from behind me forward, as if I'm kicking a soccer ball or a ball with the instep of my foot. Now, the most important part of this as I'm doing this is that I move my pelvis. I start moving my pelvis, and then I step through with my leg. After I do 10 to 15 of that motion, what I'll do is with the cable pulley system behind me again, now I'm going to turn 45 degrees to my left. And I'm going to step behind me with my right leg towards the cable pulley system, and then I'll step forward. Again, focusing the most on turning my pelvis as I do this. You should always be controlled as you're doing these motions. And after you do 10 to 15 of any of these motions, you can switch then to the next one. And after I do both angles, pointing away from the machine on a 45-degree angle, now I'm going to face the machine. And with my left leg, I'm going to face 45 degrees to the left. I'm going to step towards the machine with my right foot, and now step away with my right foot. Towards and away. My pelvis leads the motion. After I do 10 to 15 of that motion, I will now face 45 degrees to the right of where the cable pulley is coming out of the system, and step across the front of my foot, and step back. Again, leading with the pelvis, doing 10 to 15 repetitions or pulls. I recommend everyone do each motion per leg twice for 10 to 15 pulls. You should be able to keep your arms fairly relaxed during this. If your arms are stiff and waving around, you've got too much resistance and you need to lower the resistance. I will now hook myself up the other way because some people, for whatever reason, get confused when they switch from one leg to the other. And it does, for whatever reason, seem a little complicated even though it is the same principle. So now, I'm hooking this up to my left leg. I'm stepping away from the machine, standing on my right leg, facing it 45 degrees off to the side, stepping behind me towards the machine with my left leg, and then stepping in front. If you're ever doing this, and you find that you're kicking yourself in the leg with the cable or with the sport cord, you're trying to swing your leg around in a circle or in an arc too much. Try to think about stepping more straight through as you do this. Your body's spinning, but your legs should be moving in a fairly straight line. After I do 10 to 15 of that, facing my right foot to the right, now I'm going to face my right foot to the left 45 degrees. And now I'm going to step through. Now this is a soccer ball kick motion again. Stepping through, making sure I'm turning my pelvis as I'm doing this. My arms are very relaxed. You can put them on your hips. You can put them over your head. Doesn't really matter what you do with them as long as you're not trying to compensate for weakness with your arms. After 10 to 15 of this motion, I'll face the machine. Now I'm going to pull on the machine for a second because what can happen is as you're doing this and twisting your body, sometimes the ankle strap will kind of bind on your leg and it'll kind of pull your leg hair as if you've got hairy legs, or it will pull your skin. Facing the machine, I'm going to turn my right foot to the right 45 degrees, step towards the machine, and step backwards as I twist my body. After I do 10 to 15 of these, I face the machine again, face 45 degrees to the left with my right foot, step towards the machine, and step back. Some people, as they're doing this, will find that they're pivoting, the leg that they're putting the weight on is slowly turning as they're doing these exercises. Try to make sure your foot stays pointed in the same direction the whole time as you're doing one of those 4 directions of movement. But I hope this helps you out. I hope you find this an interesting exercise, and I hope you do it safely and you feel better. Thank you for watching.